Minor changes in teaching strategies can make major improvements in student learning and motivation. The following case stories show faculty who have made such improvements after participating in faculty development activities.
Demonstrating the impact of faculty development programs is difficult and infrequently attempted beyond measuring participant satisfaction. This study examines how faculty development programs affect instructional practices and the impact on student learning and motivation. The study design involved multiple steps. 10 instructors at the UT Health Science Center at San Antonio not only participated in a faculty development program, they conducted before and after classroom demonstrations and reviewed student feedback. Then the instructors met with an educational development specialist to determine an appropriate instructional change. Finally, the instructors recorded their reflection upon the instructional practice they implemented because of the program. The impact of this combination of faculty development interventions is evident in instructor behavior and student feedback post-intervention. In all cases, students completed surveys after each teaching demonstration. Student suggestions and perceptions revealed areas for improvement in instruction.
Strengths and areas for improvement that were identified by the students after the first videotaping, that I needed to clearly identify the objectives and the summary of the topic.
Here's an emergency medical services instructor who learned to introduce the topic to the class by clearly stating the objectives in the beginning of the class. This technique is proven to foster student engagement and aids in the retention of new material.
Today we're going to go through the rapid triage assessment as opposed to our general slow assessment to reinforce that. And I know you've been exposed to this before, but as a medic it's a little bit harder for you to just stay with the triage system because you want to treat so much. So we want to reinforce, because you will probably be the lead during these mass cows.
A dental hygiene instructor worked on summarizing the key points at the end of the lesson.
One of the areas that I found I need to improve on is at the end of this same class time, I need to wrap up or repeat the same information again. So that is the strategy that I will implement as a result of the study that we've done. So in the classroom, for the post-test, if you will, I repeated pretty much the same information from the beginning of the class and made sure that they had a clear understanding.
Questions? You should be asking yourself, now how am I going to treat this patient? Right? They're in your chair. You've diagnosed what's gone on. You've had a consultation with your dentist employer, and now you're trying to determine, okay, what kind of treatment plan am I going to do that's going to help the patient that's present.
We asked Mrs. Jacks if she would be likely to continue to use this strategy to summarize the lesson and reinforce learning.
The technique was very easy to employ. It just reminded me that in other lectures that I've gone to, when I think that someone has done a really good job, that's the technique that they use. They tell the students what they're going to tell them, they tell them, and they tell them what they've told them, because we all take several times hearing the same thing to really move that information into a long-term memory. And with the students, there's so many facts that they're learning all at one time that anything you can do to drive home that topic that you're trying to get across will, I think, be a good teaching tool.
Students in this nursing class also identified summarization as an area for improvement.
So we're going to do a review and we're going to play a game. I'm going to show you an easy way of interpreting blood gases. So you have to make sure you have all your little cards out in your little pieces. Okay? Any other questions? No? That's fine.
Okay.
Okay. We're done.
In an individual consultation, an educational development specialist helped Mrs. Walker develop her strategy to summarize the lesson and check for student learning. The next study participant was a palliative care fellow. Her audience was a small group of healthcare profession peers.
In summary of the objectives, I had asked the audience, what do you feel that you've learned today through the presentation that you could use to help families of patients that have died, in order to attain their benefits and know more about it, and also asked if they felt confident now and to approach that subject without having to rely on the social work, and used that as a way to summarize my objectives without sounding like I was just checking a box of, okay, I've done my summary. And I think that when they were able to give their ideas of how they could incorporate and apply it to their practice, it helped other team members think about ways they could do that too, maybe that I hadn't even talked about.
In summarizing the presentation, she took it to another level by asking the audience to envision themselves applying the lessons learned that day. A nursing instructor also needed to improve her presentation skills, particularly her facility with the electronic tools.
Bear with me, I'm going to go to the website and I'm going to pull it up. This thing is slow though, it's a little bit slow.
Mrs. Murray was able to focus on improving her skill with PowerPoint slides during a faculty development workshop. A smooth presentation helps to retain student interest in the material. In the next case, the instructor learned from the feedback that the students desired a clear link between the new material and the relevance to their own practice.
From my feedback that I got in the first class, the participants wanted me to discuss more cases that were relevant to them. So in the second class, that's what I did. Out of personal experience and the patients that I saw and the patients that I thought that the students saw in the Jerry clinics is what I described. And I thought that the students liked that really well because they were involved in the discussion when I used that.
This nursing instructor learned that making the new material relevant to the students' needs and offering opportunities to apply the new knowledge raises student engagement to the next level.
I thought it would be cool if I could have you take what I just talked about and let's apply it to a real patient case scenario and do direct application of what we just learned. What do you think? Does that sound like a plan? Pass them back. Smile and pass them back. Here. She's not smiling. Smile. What I was looking at is I didn't really have an opportunity for the students to be able to apply what I was teaching. It was kind of a one-way conversation. Sometimes I'd ask a question, but pretty much one way. So I needed to have something to make sure that what I was presenting was being understood and comprehended. So I was looking for a strategy that I wanted to do that. Plus, I'm going to have to do something that would include all of them at one time. So I decided that I was going to look at using a case scenario where I would present the content that I was working on that day, and when I finished a piece of it, I would have a case scenario, the little patient description, and then I'd read it off to the students and then ask for their feedback, say, now, based on what you just learned, what would you do then? And so I decided to set up these case scenarios for the 3 sections that I did for it.
The 10 case stories illustrate how instructors reacted to student feedback and made changes to their teaching strategies with the help of faculty development activities. Areas for improvement including informing students of objectives, presenting information and examples, providing practice, and summarizing the lesson. Post-intervention reflections indicate increased instructor awareness and confidence. It is clear that these 10 instructors benefited from the combination of classroom observation, student feedback, personal consultation, and faculty development activities.
Really, I think the course was helpful for me to think outside the box, identify other areas that I hadn't really explored, because it really opened up a lot more ideas as to how we can teach, how we can identify where we need to focus more attention. You know, I think a lot of the problem in education is that we have feedback on what we do well, and we do it over and over. And so most of our attention seems to go there because it works well, let's just keep doing it. But I think we kind of forget about the areas that we're not doing well on. And really, I think more focus needs to go into the areas where we're not succeeding. And that way you have a more success overall.